Okay, now let's begin by reviewing the reflexes in infants. Moro reflex. This is triggered by sudden movement or noise. The infant responds with a startled arms and legs extend. This reflex disappears by 3 months. The rooting reflex. When the cheek is stroked, the head turns out and then the infant begins sucking motions. This disappears by 9 months. The Babinski reflex. The stroking sole of the foot causes the toes to fan out. This reflex typically disappears by 4 months. The grasping reflex. Stroking the palm leads to the infant making a fist. Now it fades by 4 months. And lastly, stepping reflex. This is when the feet touch the surface, stepping motions are observed. This too disappears by 4 months. Now turning to gross motor skills. These involve large muscle activities like crawling and walking. Parents often mark milestones such as sitting, crawling, and taking first steps. The posture development is foundational. It draws on sensory input from muscles, joints, skin, the vestibular system, vision, and hearing. In the first few weeks, infants can hold their head erect while prone. Now, by 2 months, they can sit with support. At 6 to 7 months, they sit independently. Around 8 to 9 months, they pull to stand. And by 10 to 12 months, many can stand alone. Now, in learning to walk, walking involves balancing in one leg and shifting weight. Although the leg motion is present prenatally, actual walking takes about 1 year due to biomechanical challenges. Infants learn safe locomotion through experience. A Duff's 1997 study found that new crawlers and walkers often misjudged slopes but eventually adapted, avoiding the risky ones, the evidence of perceptual motor coupling. Practice is key. Infants takes around 2,368 steps and fall 17 times per hour. In motor milestones that vary by 2 to 4 months and are influenced by these three, the early development factors, which is like the birth size, the rapid growth, and the breastfeeding. Delayed milestones can also result from maternal smoking. And lastly, the cultural environmental factors that also matters, like for example, since 1992, US infants tend to crawl later due to the back sleeping guidelines, and some also skip crawling entirely and go straight to walking. This is common in infants from Mali and Jamaica. In the second year motor development, it includes the 13 to 18 months where the pulling of toys and the climbing steps. And then the 18 to 24 months, this is where the walking fast, the squatting, the kicking and throwing the balls, also the jumping in place. Structured exercise is not recommended for infants. Free movements is best. The cultural variation in motor stimulation shows that in Africa, India, and the Caribbean, caregivers massage and stretch babies leading to earlier milestones. Jamaican mothers expect earlier sitting and walking compared to the English mothers. Restricted movements like swaddling or sandbagging in China can delay development. Through these effects, they usually decrease as infants grow. Okay, now this here is the sample chart for the gross motor skills. Fine motor skills. This involves precision movements like grasping a toy or buttoning a shirt. Newborns have limited control, but the building blocks are present. The reaching and grasping development, it evolves from the crude shoulder to elbow use, to refined wrist rotation and thumb forefinger coordination. By the end of the first year, infants shift from a palmar grasp to a pincher grip. Now, the experience plays a big role. The sticky mitten training accelerates grasping and exploration. A reaching experience boosts object exploration by 5.5 months. Now, as crawling and pincher grasp develop, infants starts exploring with their mouths, requiring the parental vigilance. Now, the tool used like spoons or rakes shows early planning and problem solving by 12 months. Banging become controlled and precise. Sensory and perceptual development. Infants learn about the world through their senses: vision, hearing, touch, and taste and smell. The sensation is the detection of stimuli, while perception is the interpretation. For example, a sound wave becomes a music, or light becomes a recognizable face. The ecological view. James and Eleanor Gibson proposed that infants directly perceive environmental information. Objects offers affordances, opportunities to act. For example, a spoon affords eating for an adult but banging for a baby. And through this experience, infants learns what's safe to walk on or when to crawl. Studies shows experienced movers avoid steep slopes while beginners don't. Infants become better at using affordances over time. Visual perception. At birth, vision is limited, about 20 to over 240, but 6 months it improves to 20 over 40. The faces draw the most attention, especially attractive ones. This is how newborn perception is studied. There are 6 methods that are used: the visual preference, the habituation or dishabituation, high amplitude sucking, orienting response, eye tracking, and lastly, the specialized equipment. Fan's classic studies showed infants prefer patterns like faces over plain colors. This is the visual preference method. Now, the habituation is when infants lost interest in repeated stimuli. This habituation shows renewed interest with new input, indicating recognition. Now, the other senses, like hearing, it is when the fetus hear in the last 2 months of pregnancy. When newborns recognize the voice and music heard prenatally, brain responses to sound begin around 33 to 34 weeks gestation. The full adult like hearing develops by age 5 to 10. The touch and pain. This is when newborns respond to touch and feel pain. The gentle prenatal stimulation is linked to calmer temperament. The MRI shows newborn have developed pain matrix, and the kangaroo cares reduces pain responses. And then the smell. This is when newborns distinguish smells, prefer vanilla over unpleasant odors, and they recognize his mother's scent by 6 days. The taste. The taste sensitivity begins before birth. The newborns react to sweet, sour, and bitter. It is also when the preference for salty taste appears around 4 months. The intermodal perception. This is the ability to integrate information from multiple senses, like seeing and hearing a bouncing ball. Newborns shows early signs of this, such as turning to sounds by 3 months. They recognizes their parents' voice with matching visuals. By the second half of the first year, the integration improves significantly. Nature, nurture, and perceptual development. Is perception innate or learned? The answer is both. Nativist says it's inborn, and the empiricist says it's learned. Most researchers now agree it's a combination. The ecological view emphasizes real world interactions, while Piaget linked perception to cognition. Daphne Mohrer's research on the cataract removal shows early pattern input is crucial. Delayed treatment causes lasting deficits, showing there's a sensitive period for normal visual development. Perceptual motor coupling. Perception and action are not separate, they're intertwined. Dynamic systems theory explains how infants build motor behaviors through feedback loops between the body and the environment. For instance, reaching a toy requires visual assessment like motor planning and balance. Manual exploration teaches textures and size. Walking teaches distance and surface safety. Unlike older fixed stage theories, modern views emphasize the active learning through experience. As developmental psychologist Herb Peak once said, the infant's is by no means as helpless as it looks and is quite capable of some very complex and important actions.